First and foremost, the primary stakeholder here is always going to be the patient, because it is the patient that is going to bear the brunt of any inaccuracies that occur throughout the process. So ultimately, they're the ones that have the greatest risk to reward ratio here. So if you have, let's say, some sort of mistake during variant interpretation, and you say that a variant is not pathogenic, so that'll usually fall in kind of in the more technical terms as a variant of uncertain significance, likely benign or benign. And generally, that is a variant that a clinician isn't going to take an action on. Let's say there's a mistake there and a interpretation scientist like myself calls it a VUS when it's actually pathogenic. Now that can drastically affect the type of patient care that somebody gets and can extend the time that it takes for a patient to actually get a diagnosis as well. Or even worse yet, can result in some sort of negative treatment or negative health-related response due to the treatment. Another key one that's often not thought of would be insurers. So as an insurer, you really want to make sure that your patient is getting high quality diagnosis, because as an insurer, if your patient gets a diagnosis, they can go on a treatment regimen, and generally if they get that diagnosis quickly and accurately, then the cost of care is going to be lower for the insurer. Some of the other key stakeholders in this are generally the genetic testing companies. You want to give patients the best possible care, but you also have to make money, or at least break even a lot of times. You've also got the instrument companies that create either instruments or any reagents that we use in the actual sample preparation or the running of any of our sequencers. And the main reason for this, that they are stakeholders, is because they want to make sure that variant interpretation quality is still high, because you don't necessarily want patients to have negative opinion of genetic testing. So if you have high quality genetic interpretation from a scientist, it's going to make the patients be more confident in this technology, and therefore companies that supply these type of things are going to be selling more, obviously. So they have a huge stake in variant interpretation as well.